If you're investing in social development, like many of the people on this call, you're likely wondering how you can measure the quality of your impact to know if it'll be sustainable and make the intended difference that you're wanting to do. Well, at Mind the Class, we're reducing the risk of preventable mental health problems by designing mentally healthier communities. We're disambiguating the social data. We're dedicated to providing the science behind and the evidence behind positive psychological health. We're using behavioral science to equip social and government programs with data-driven decision-making. Schools, human services, and nonprofits risk not investing at this point in prevention. There's been a 13% rise in mental health conditions globally since 2017. This rise has led to a lag in services. In the US alone, 77% of counties do not have enough therapists to meet the demand. This creates an 11-year delay in services, particularly for vulnerable high-risk groups. This leads to a very reactive culture that I observed firsthand over the last 18 years as a clinical director focused on crisis response. This leads my teams to burnout, low quality care, and leads people to chronic conditions. About 50% of all people with mental illness develop comorbid conditions. This is costly programmatically. It leads to a rise in emergency services, high healthcare costs, burden on caretakers, workforce productivity issues, joblessness, homelessness. And mental health accounts for 35% of the global economic burden for non-communicable diseases. So despite decades of positive psychology, there's a critical need for a comprehensive framework that protects young people from the risks of mental health problems that can have a negative impact on all areas of their life. Our industry continues to ask the wrong question. Instead of asking what's the root cause of mental health problems, we need to be asking what's the root cause of mental wellness. We've defined measurable research-based protective factors in our 5 elements framework to identify and strengthen the conditions that contribute to positive mental health outcomes. Our technology also proactively detects potential risks and provides preventive solutions to promote stress resilience. We analyze comprehensive data within the context of individual, interpersonal, community, society factors and uncover those hidden patterns and provide scientifically backed insights. We map this to our evidence-based solutions through our automation pathway software, and that guides teams to effectively building those factors into their programs and demonstrates the value of the impact of their initiatives. And then with consultation from licensed professionals, we use our equip model to support the teams with the step-by-step strategies to unite stakeholders, implement manageable, sustainable changes within community and technical partnerships. And these insights and evidence-based improvements increase the psychological health for youth and professionals. This also increases teams' chance of securing and maintaining the funding for the most effective preventive mental health initiatives. So we have a competitive advantage. Our approach is more profitable, scalable, and impactful. Consulting and treatment models lack the evidence-based evaluation practices, and they lack the ability to reduce risks and therefore reverse the rising rates of mental and behavioral health disorders. Nonprofit-dominated sector relies on grants and government funding. It lacks sustainability, agility, and profitability. Siloed therapeutic programs address one patient's problem with a single solution following pathological symptoms. The programs rely on therapies and medications, lacking a system-wide comprehensive approach. The software solutions are solving for a reduction in symptoms, treatment solutions, or access to care, but this often costs money to patients directly or are paid for by insurance models. It doesn't offer the same return on investment as it does when you prevent them from incurring those costs. We have an impact-focused marketing strategy that funnels into partnerships and affiliate sales process. Our university, digital, therapeutic, and community partners support a warm handoff approach. We sell into a B2B market, schools, colleges, social and governmental programs. We provide those analytics and expert consultation to build capacity in the system. And then we move teams to a subscription plan to continue to advance their preventive practices using our guided software. This improves our scalability and allows us to bundle discounts to increase our impact. I've been working in applied behavioral sciences and behavioral analysis for 18 years, strengthening clinical programs with similar data-driven solutions. And we have a strong research, technical, and marketing team members. We have a highly invested advisory group to fill our business model gaps, as well as 5 consulting universities, 5 consultants from 5 different universities. And our costs run lean. We have a remote workforce and a strategic hiring plan to bring people on as we grow. Our research of over 2,000 studies was completed in 2020 with market validation. Our valuation model was developed and completed in 2021. We successfully ran a pilot program in a community of 12 schools, reducing post-COVID violence in one community, improving mental wellness, and increasing school attendance for youth, and re-engaged fearful teachers. We presented our research at 2 international conferences last year. Mind the Class is a winner of the CAI Child Health Challenge last year, and we were published in OECD OPSI as a leading global health governmental innovation. This year, we developed a prototype of our software, and we're moving into full development. We're looking for partners that value youth mental health and can help us build and launch quickly. With a steady projection at $20,000 per project contract at an average market rate for data insight SaaS models, we can scale to $5 million in revenue over 5 years, having a positive impact on about 30,000 youth and 15,000 supportive adults. This significantly reduced costs for schools and social programs, increasing their social impact, building safer, healthier communities, and reducing professional stress. This allows our clients to also justify budgetary spending and strategically plan mental health expenses and have a higher impact per dollar spent. You can validate your impact. We're providing disambiguated social data that uncovers pathways to protect youth from risks. We're providing data insights that validate genuinely impactful programs and drive quality funding. And the research-driven strategic planning builds ecosystemic capacity at a cost savings. We're hoping that you will use this to build your portfolio and use your strategic network to help make a critical impact on future generations' mental well-being, while helping build something that validates your personal and corporate social impact. Thank you so much. Please reach out to us if you're interested in partnering for impact.